When I first arrived at Overfelt and I started covering practices and games, I noticed the amount of injuries that kids were coming to see me. I realized that this was an at-risk population. At the high school level, they're more at risk because they're still developing neurocognitively as well as physically. Contact sports are the sports that are most at risk: basketball, football, wrestling, cheerleading, but it can happen in any sport. The athletes play with heart. They go out there and they're gonna play their hardest. It puts them at risk for either injuring somebody else or getting injured themselves. Sports are really important here, I believe. It creates this sense of community, and there are kids here who live in poverty, and having sports as their outlet, it keeps them out of trouble, it keeps them out of gangs. It's like a family.
Here at Overfelt, there are probably close to 500 students involved in organized sports, and at a school of 1,500, that's at least 1/3 of the students. Our students are facing just the obstacles that come with living in poverty, whether that's crime or dense housing or poor health care, and they struggle through that on a daily basis. There's not a lot of money in the community, and there's not a lot of money in the school. Although students love it and it's the thing they engage and their parents get behind them and it brings the community together, we also know that there's a danger there. And so Adrianna is the first time we've ever had an athletic trainer on campus regularly working with our students, and she's amazing.
The Dignity Health Concussion Network program involves education, which is the BrainBook app. It involves cognitive testing, which is the impact test. And then it also involves consultation, where I'm able to consult with concussion specialists and neurologists to help guide me when a kid does get injured or get a concussion. We'll also test them multiple times because we want to send them back with an absolute perfect baseline score. And if there's even one symptom left, I won't send them back in. I go to work knowing that I'm making a difference in the lives of these kids. I'm there as their healthcare provider, but I'm also there as someone they can confide in and trust in and come to me for more than just injuries. A lot of times I'm there helping them get through that injury emotionally and psychologically and as well as physically.
There are 1 million high school students in the state of California at risk of concussions through sports. The program through Dignity Health has exceeded our expectations. Not only do we have an expert here and an increased awareness of concussions, but that increased awareness extends well beyond me, extends to the coaches, the parents, and the students themselves. The students are fantastic, and although they face struggles daily, they work so hard to overcome them and see the brightness and optimism of the future.
Every high school should have a program like the Dignity Health Concussion Program. Anywhere where there is athletics, this program should be implemented because it's been so successful. The goal is not to take sports away from them, it's to be able to keep them doing what they're doing, be able to keep them in sports and keep them healthy and strong and able to do what they love.